Let's have a blunt conversation about smoking and breastfeeding. In reality, if you are choosing to breastfeed, it is better to try to quit or reduce your smoking while you're breastfeeding. That said, the research shows that it is better to continue to breastfeed if you are choosing to still smoke than to switch to formula feeding and still continue to smoke. So let's break this down. This video is specifically for parents who are already smoking, who are deciding that they may not be able to quit smoking or cut back on smoking at this current time. The best recommendation is to try to cut back on smoking or to try to completely quit smoking while breastfeeding your baby. But if you're not at that point in your journey yet and you're choosing between breastfeeding or formula feeding, the research says that it is better to continue to breastfeed than to wean and continue to smoke and formula feed. All right. So some people don't realize that this is the current recommendation, that even if you are continuing to smoke, best practice says continue to breastfeed. It is actually better for the baby for you to continue to breastfeed than to wean and switch to formula. Most will assume or may be told by other healthcare providers that they need to wean if they're going to continue to smoke. The American Academy of Pediatrics removed nicotine from its list of contraindicated substances during breastfeeding. The American Academy of Pediatrics statement issued in 2001 says, in part, one study reported that among women who continue to smoke throughout breastfeeding, the incidence of acute respiratory illness is decreased among their infants compared with infants of mothers who bottle-fed formula. It may be that breastfeeding and smoking is less detrimental to the child than bottle feeding formula and smoking. They are not encouraging smoking. They are saying that the effects of the infant are better if that baby is receiving breast milk over formula. Now, if you are choosing to continue to breastfeed while smoking, there are some factors that you need to be aware of. Smoking can lower milk supply and inhibit your milk ejection or milk letdown reflex for you and the baby. So you'll want to be aware that you might have lower supply because of the smoking. Your baby is also at an increased risk of colic, poor weight gain, respiratory infections, and there is an increased risk of sudden infant death syndrome, SIDS. Your milk does not eliminate these risks, but it does significantly lower these risks compared to formula feeding. Breastfeeding also helps protect the baby from potential risks of environmental smoke. So if you are choosing to continue smoking and are choosing to continue breastfeeding, there are a couple strategies that can help. One is wait as much time as possible between smoking and breastfeeding to lower the amount of nicotine that passes into your milk. Smoke right after breastfeeding and away from the baby. This gives you plenty of time between those breastfeeding sessions for nicotine to clear from your milk. If you do smoke outside of the house, away from the baby, and change your clothes and wash your hands before coming back in to take care of the baby. Also have other smokers in the home do the same. You could also consider wearing a smoker jacket or something else, again, clothing that you can remove so that you're removing that smoke from when you're handling the baby. E-cigarettes and vapes have the same risks. There is limited research about the safety and health effects of e-cigarettes, but until proven otherwise, the healthcare community considers that e-cigarettes and vaping are going to carry the same risks to you and the baby. If you are choosing to smoke and breastfeed, you will want to monitor your baby's weight gain, make sure that they are getting enough milk, and obviously monitor your milk supply. So this is the current information and recommendations that we have if you are currently smoking and again you want to choose between breastfeeding and formula feeding. If you're trying to make a decision whether you continue breastfeeding or whether you would wean from breastfeeding, know that the current American Academy of Pediatrics recommendation is to continue breastfeeding your baby while you would potentially be working on trying to eliminate or reduce your smoking. Now you know.